One of those sets of disruptions has been people's concern with the loss of healthcare insurance, especially during a medical pandemic. So I'd like to introduce, as our third guest this afternoon, Judy Mohr Peterson, PhD, the MedQuest Division Administrator for the State of Hawaii's Department of Human Services. That's quite a mouthful, but aloha, Judy, welcome.
Aloha, thank you so much for having me.
So, what are the health options that are out there available to those in the public who may have recently lost their jobs or lost their job-based health insurance coverage?
Oh, thank you so much for that question. And we do know that many people have lost their health insurance coverage. And we're very happy and very pleased that we can be here as a Medicaid agency to be able to be that safety net for access to health insurance. In the last 10 months, we've actually seen our enrollment grow by over 20%. It's up around 24%. Over 400,000 people now are on or covered by Quest, which is what we call our Medicaid program. And we're open all the time. In other words, if you were to lose your health insurance or not have access to it, you can always come and apply. And just like Director Betts was outlining before, you can find that information on the DHS website. But besides that, many people, they may not qualify for Medicaid. And there are other options for them. Earlier there was an open enrollment on something called the marketplace, the federal marketplace. Some people may be more familiar with that, as they might know it as Obamacare or something like that. So we do have that as an option that's going on right now. Now, if you were to lose your health insurance, that would be considered like a special occurrence or a special event that would allow you to apply on the marketplace coverage. But what's going on right now between February 15th and May 15th is another open enrollment time period. And that's for anyone who's uninsured right now, whether you've lost your job or you've just been uninsured. And this is, as you noted before, a global pandemic. It's a medical emergency. And so you may need and want health insurance. So now is the time in which you can apply for that. So you can apply on what's called on healthcare.gov. So and it's healthcare.gov. To pay attention to that last little bit there. There's some other entities that will pop up if you don't use that one. You can also call, and if you call in, then you can also receive special language assistance. So you don't speak English and you need some extra help, they can get some additional help on for you. I have that number and I can read it out. I have to look it up here. And so that phone number is 1-800-318-2596. Again, that is for the marketplace, the federal marketplace, which some people may know as Obamacare.
I think that's interesting you call it Obamacare because some people are now seeing it as Biden care. The open enrollment was in fact because President Biden has now, by executive order, said, let's reopen this. We have millions and millions of people who need health insurance, and this is the way that we can do it. So that's what we're doing, right? And I thank you for sharing that information.
Yeah, no, it's very exciting, and we're very pleased that is another option. We've already started to see. We just checked, and we started to see Hawaii residents already started to apply at much greater numbers than even in the prior two open enrollment time periods. So it's good news. I hope if people do find themselves uninsured, they will take advantage of this opportunity. It's vital to have health insurance, especially during a pandemic.
Thank you. And thank you for all of the incredible work that you're doing with Medicaid, Judy. Let's get a little bit of wonky here. There are some.
I like wonky.
I like wonky, and Medicaid is so complicated. And I know that we brought you out. We stole you. I will say that right off the bat. We stole you from Oregon, and we brought you out here. Medicaid is really doing quite a number of interesting things. And so, can you talk about some of those? Kind of just your short and long-term thoughts about what Medicaid and Hawaii's Medicaid program is doing?
Yeah, thank you for that question. It's like it's hard to picture like working on these things because we've been so focused on the pandemic for the past year. We put a number of things on the side and didn't, sort of put them aside as we really focused quite a bit on responding to the pandemic. But we had in the works, and we still have in the works, several approaches or several perspectives that we're trying to build up. I think about it as using both a short-term investment approach and a long-term investment approach to healthcare and transforming the way in which care is done in practice. So in talking about the short-term investment strategy, that's to really focus on in what ways can we improve care for people who have really complex health needs. They might have diabetes along with serious mental illness. And traditionally, those two types of healthcare systems, mental health and medical, they don't sort of talk to each other. They don't work together very well. And it's very fragmented types of care. So in order to improve care, we need to have those different healthcare systems working together in team-based care, sharing that information together, working with the person to help improve their care. If we know that if we do that, if we improve that integration of care, that not only does it help the person improve their care and they have better health and better health outcomes, it helps the bottom line. Healthcare is expensive. There's a lot of dollars that flow into healthcare. And this is a way in which you can use those dollars more efficiently and effectively. So it's really it's an excellent way to improve health, improve well-being, and to help save a dollar and use those dollars in a more wise way. The other thing, and this is what the prior speakers were discussing, and that's really a focus and an investment on young children and their families. And so one way to do that is by focusing on primary care, focusing on health, promotion, helping to make sure that kids can get into care, they get their well child visits, they get their immunizations, so that they can do well in school, they can do well when they're they can just do well in their at home. So we've been looking at many different ways that we can help kids' behavioral health, how we can help make sure that we can improve the screenings, and making sure that we can help get more kids in to get their vaccinations, which are so important to kids' overall health. We've also been partnering with the schools to help have stronger partnerships there. We're working with, we're partnering with a group called Project Vision and Vision to Learn to improve screenings and glasses for kids in schools. So we have lots of different partnerships that were kind of put on hold for a little while, and now we're people are reaching out to us, and we're reaching out to them to revisit those. So that's kind of a long-term investment, because those strategies of investing in kids and kids' health and families, that pays off in the long years down the line. We've seen a drop-off during the pandemic of kids coming in for their care. So I would be remiss if I didn't have that message, that public service announcement, that please take your kids in for their well child visits, go see the doctor, their pediatricians. They're set up to help you and take care of your kid in a safe way.
I'm listening to you talk and hearing you talk about partnerships and collaboration. And I know you work very well with Eddie Mercero, who was a guest on this show several episodes ago. I also know you're working very well with Chair Yamani, who now has oversight of Health and Human Services, kind of a nod to this notion that we have to combine these two areas.
Yes, that's right. We have really strong partnerships. We've been working really closely with the Behavioral Health Administration for a number of years, but particularly since Eddie's come on board, and then now with Chair Yamane, and looking for ways in which Medicaid can partner more strongly and better with behavioral health, with mental health and substance use treatment. I'm thinking about it more from a continuum of care and not from, well, we cover up to here, and then that's not us, after on this side of the fence, that's you. And so we're trying to think about, well, what's the continuum of care, everything from residential treatment, which is the highest intensive treatment, which is also needed, all the way down to the community-based care, outpatient treatment, et cetera. And what ways can we partner together for the best use of those resources, be it paid for by behavioral health or be it paid for by Medicaid and supported by our programs. So which ways can we partner and really have that handshake together in working together? Another key area, which I don't know if you would be bringing it up or not, is actually on the homelessness area, which is also an area that Chair Imani, he chairs health, human services,
That's right,
and homelessness. So it's the 3 H's. And I think it's really indicative of the fact that there is this really strong nexus where, of course, there's a lot of behavioral health that doesn't involve human services or homelessness. There's people who are homeless who don't have behavioral health needs, et cetera. But we do know that the individuals who have both behavioral health needs, either be it substance use or mental health, they are also homeless. We've done a lot of partnership and a lot of work in the Medicaid space in that area as well. We asked for special permission to be able to cover additional services by Medicaid so that we could bring some additional dollars in, some additional supports in to help address that. It's taken us a couple of years to get off the ground, and I would say that we're still in that kind of baby step area. We're very excited about those as opportunities to be able to really address a community-wide problem or issue that's only heightened with the pandemic. More people are suffering from mental illness and substance use, and this is a good way to help partner and bring that together.
I think it's so critical the way that you're approaching this, the way the Department of Health, and I think with the new mayor in the city and county of Honolulu, it's going to be exciting to see what we can do if we're all kind of working at this collaboratively, a great lesson that we've learned from this pandemic. We have a couple of minutes left, and I wanted to give you this opportunity to further embarrass Director Kathy Betts. I know you work directly with her. Medicaid is a division under Department of Human Services, but do you want to say anything to Director Betts, who's not here to defend herself? We're not letting her defend herself.
Yes. I have, it's been such a pleasure to work with and for Director Kathy Betts. I worked with her for a number of years because she served as she was the executive director of the Commission on the Status of Women, as well as the deputy director. And so, I've known her for a few years here, and it's rare to find a person with that level of commitment and passion, and just she cares about these services at the depth of her soul, and she's a mom, and I think that makes a difference in just how she approaches and how she thinks about the impact of our services on families and on children, because she knows it firsthand. So it's been a pleasure, and I'm so honored to be able to have the chance to work with her. And
Well,
thanks
I'm
for that
honored
opportunity to embarrass her. So,
I have the pleasure to work with you and Director Betts. So thank you for all your service to Hawaii and to Hawaii's people. We really do need you to stay there as long as possible at DHS, please. I want to thank
commitment here. Yeah. Thank you.